Welcome to the training program on auditing your 4 moments for hand hygiene. Auditors need to complete the following training components before auditing. Your 4 moments for hand hygiene for long-term care homes. Watch the Just Clean Your Hands DVD for healthcare professionals, staff, and volunteers in long-term care homes. Watch How to Hand Rub Your Hands and How to Hand Wash Your Hands. Review the observational tool and the directions on the back prior to starting this training session. Review hand hygiene, observation, and analysis. All of the above tools are available at www.ontario.ca/hand hygiene. Then watch these audit training scenarios and discuss and debrief with a mentor. This is important when you first start auditing, and it helps to periodically check in after an audit session. Some common questions we often get are, who and what is to be audited? Audit healthcare providers, staff, on your 4 moments for hand hygiene. Who can be an auditor? Auditors must be trained in the 4 moments and the audit process, feel comfortable in clinical settings, and respect and maintain confidentiality of others. Where should the audits be done? In long-term care homes, it is recommended that auditing of the 4 moments be conducted in resident rooms. It's important to prevent other organisms from being brought into the resident's room space. It is also important not to move the resident's organisms from his or her space into another resident's area. A long-term care home may choose to audit direct care in other areas where direct care is provided as additional audits. Let's review the 4 moments. Moment 1 is before initial resident-resident environment contact. Moment 2, before a septic procedure. Moment 3, after body fluid exposure risk. Moment 4, after resident-resident environment contact. Moment 1, before initial resident-resident environmental contact. This means hands need to be cleaned before touching the resident or touching any furniture or object in the resident's environment. Moment 2, clean hands before an aseptic procedure. Examples of Moment 2 are before oral dental care, administering eye drops, catheter insertion, or changing a dressing. Moment 3, clean hands after body fluid exposure risk. Examples of Moment 3 are changing continence products, after shaving a resident if a nick occurs. Moment 4, clean hands after resident-resident environment contact, after you leave the resident's room, if you have touched the resident or any object in the resident's environment. On this slide, you see what we call the resident's environment. In a single room, this is everything in the resident's room, including the resident's bathroom. In a multiple room, this is everything in the immediate area around the resident. Examples are the bed, night table, and chair. This does not include the resident's shared bathroom. In the resident's room, staff, volunteers, and family members are to clean hands following your 4 moments for hand hygiene. Cleaning hands. Alcohol-based hand rub is the preferred method to clean hands. In the following scenarios, there is alcohol-based hand rub placed at the door of each resident room, near the resident bathroom, on the medication cart and housekeeping cart, to assist in having the product at point of care. When you see staff cleaning their hands, they are using alcohol-based hand rub. Hand washing is only recommended when hands are visibly soiled. Please note that the best practice documents indicate that sinks must not be used for both hand washing and any other purpose, for example, cleaning of equipment and emptying solutions, since this increases the risk of subsequent hand contamination. If there are no dedicated hand washing sinks for staff other than the resident washroom, alcohol-based hand rub should be used to clean hands. Now let's start the audit training. I want to note that the scenarios you will see have been developed to focus on the opportunities to perform hand hygiene and are not intended to show best practices for providing care. First, have your observation tool forms and a pencil ready.